Welcome to Connective Care Education. Today we are going to look at Unit 001, Principles and Values of Health and Social Care Adults. Unit 001, Outcome 9, Knowing how positive approaches can be used to reduce restrictive practices in social care. Positive approaches and restrictive practices. Introduction. Behaviours which challenge services always happen for a reason and might be the only way an individual is able to communicate. This behaviour can happen for different reasons, which are specific to the individual. Individuals who display or are at risk of displaying behaviours which could be challenging might need care and support which involves positive behavioural support and some form of restrictive practice or intervention. It is vitally important that it is person-centred, meets an individual's needs with dignity and respect, and minimises the risks to the individual being cared for and the individual carrying out the physical intervention. So what are positive approaches? Positive approaches are based upon the principles of person-centred care, getting to know an individual, respecting and valuing their histories and backgrounds, and understanding their likes and dislikes, their skills and abilities, their preferred communication style and support structures, understanding the impact of their environment upon them and using this to identify ways to support individuals consistently in every aspect of the care they receive. Positive approaches involve working with an individual and their support systems to try to understand what they are feeling and why they are responding in the way they are, where possible, undertake any required changes and intervene at an early stage to try and prevent difficult situations at all, and understand what needs to be planned and put into place in order to support the individual to manage distressed and angry feelings in a way that reduces the need for behaviour that challenges any restrictions. What are restrictive practices? Restrictive practices are a wide range of activities that restrict an individual's ability to do what they want to do without some form of intervention or encourages them to do things that they don't want to do. They can be very obvious or very subtle. They should be understood as part of a continuum from limiting choice to reactive response to an incident or an emergency, or if an individual is going to seriously harm themselves or others. So now let's look at the underlying causes that may impact upon behaviour of individuals. What influences an individual's behaviour? Think of some reasons a person may be upset or distressed which could affect their behaviour. Underlying causes could include chronic or acute pain, infection or other physical pain, sensory loss, an acquired brain injury or other neurological condition, communication difficulties, the environment, fear and anxiety, unhappiness, boredom, loneliness, unmet needs, demands, change, transitions, recent significant events such as death of a family member, past events or experiences, abuse or trauma, bullying, over-controlling care, or being ignored. So now we'll look at positive approaches that can be used to reduce restrictive practices and promote positive behaviour. Positive approaches. When working with an individual with a particular syndrome, disability or condition, it is important to have a full understanding of the possible effect on behaviour. For example, a person with autism and a learning disability may present behaviour that their family members and support workers find difficult to understand and that they believe to be challenging. A greater understanding of the individual will enable workers to be better equipped to know what to do and how to prevent specific responses on other occasions. It is easier to understand an individual's behaviour if workers have a better understanding of their experiences. This may include considering how having a particular syndrome, disability or condition has affected their communication, social interactions and sensory awareness. What happens in the environment around the individual is often under the control of the individual supporting them. For example, If an individual finds being with many other individuals in a small room difficult, then the impact of this can be reduced simply by ensuring that the individual does not spend time in confined spaces with lots of individuals. Communication breakdown may contribute to challenging behaviour, so it is important to understand individuals' approach to communication and work to better understand what they are trying to say or indicate. Positive approaches. And lastly, please pause the video here and complete worksheet Learning Outcome 9, Worksheet 1, Positive Approaches.